What is bipolar? Bipolar disorder is a condition that's caused by a disruption in the mechanisms that regulate mood, leading to unusually intense or frequent shifts in mood. Bipolar disorder usually involves an alternation between depressive episodes, periods of normal function, and energized episodes. Biological factors are important in the etiology of bipolar disorder, and it's transmitted genetically. Bipolar disorder is also chronic and recurrent, but we have effective treatments to keep bipolar disorder in check and make it manageable. People with bipolar experience one or more episodes of greater than normal energy, as shown in the picture on the right by the hot pink. And of course, everyone has normal variability in mood, so we're not aiming when we work with someone with bipolar to aim for a perfect midline, but rather a manageable range. Bipolar implies an alternation, a seemingly equal alternation of up and down episodes, but for most people with bipolar, it's depression that predominates, and the proportion can be quite unbalanced. In fact, you only have to have had one episode of mania or hypomania to be diagnosed with bipolar. We'll talk a little bit about different types of bipolar: bipolar 1, bipolar 2, other types of bipolar, and something called cyclothymia. Not all bipolar is the same. Bipolar 1 involves extremes of energized states, mania, and lethargic or slowed down states, depression. Bipolar 2, by contrast, has milder energized states, hypomania or a little mania, that alternate with depression. And cyclothymia has both mild energized and mild depressed states. There's a strong genetic component of bipolar. A family history of bipolar disorder is one of the strongest and most consistent risk factors for bipolar. There is a 5 to 10-fold increased risk among adult relatives of people with bipolar 1 and bipolar 2 disorders. So you see here the risk of bipolar in someone with no family history is about 2%. If you have a non-identical twin, fraternal twin, then it's about 10%. If you have one parent with bipolar, it's also about 10%. And even if you have two parents, it's still only about 40%. And if you happen to have an identical twin with bipolar, then it's 50%. So pretty high, but not everyone with an identical twin with bipolar will develop bipolar. So genetics are very important, but not the entire story. So the odds of a child without bipolar in someone who has bipolar and is married are higher than having a child with bipolar. Even if you happen to marry someone who also has bipolar, your child is less likely to be bipolar than not. So how common is bipolar? Bipolar and related disorders, the different types that we talked about, may have a lifetime prevalence as high as 4%, meaning over the lifetime of a person, about a 4% chance of developing bipolar, 1% bipolar 1, 1% bipolar 2, and 2% subthreshold or other forms of bipolar disorder. By contrast, major depression has a prevalence of 16%, so about 4 times the likelihood. And so looking at other medical conditions, you see that the lifetime risk of developing HIV is currently about 0.2%. Bipolar 4, dementia 4, so about the same. Diabetes, about twice as likely to develop. Breast cancer 3 times, depression 4 times, and any cancer is in about 33% of people. So not extremely rare, but not extremely common either. Bipolar 2 is more common in women than men, bipolar 1 about equal. Peak age at onset for bipolar and related disorders is in the late teens to early 20s. There's some evidence that there's a second smaller increase in bipolar symptoms in those over age 50. But you can see here that the blue and the light green men and women both have the same typical onset somewhere between age 15 and 25. Age of first treatment usually lags the age of first symptoms by 6 to 8 years, so there's an important gap there. And the age at first onset is declining and for unknown reasons is lower in the United States than it is in Europe. Let's talk a little bit about causes and triggers. So genes, of course, are important, but not everybody with the same genes will develop bipolar. Many people with bipolar are the only ones in their family with the condition. One reason may be a phenomenon called skipped generations, where in some families the risk may be greater in grandchildren of people with bipolar than in children. And of course, there are spontaneous or new development of cases. And then finally, probably most importantly, there may well be a lack of awareness or denial of family members. So the angry alcoholic in your family or the creative eccentric may just simply be an undiagnosed case of bipolar. Triggering factors play a role, especially in early bipolar episodes. So the disorder may not present if there aren't these triggers. It's a complicated way of saying that people with the same genes, that is to say identical twins, only half of those with the same genes will develop bipolar if their identical twin does. So this first episode, whether you develop it or not, may be linked to environmentally stressful situations, which in turn trigger biological mechanisms. But with every episode, a person may become more vulnerable to stressful situations, and episodes happen more frequently, and then they may become independent of stressors happening spontaneously. So the way we think about this is genetics and triggers and perhaps other risk factors all work together to create this condition called bipolar. Let's talk a little bit about the brain, your brain. The most important parts of the brain involved in regulating emotion are the limbic system, which is kind of the core of the brain, involving the amygdala, hippocampus, hypothalamus, and thalamus. And this is the so-called emotional or reptilian part of the brain because it's one of the oldest parts of brain. And then the frontal cortex or prefrontal cortex, which is actually the newest area in the brain and the part that's the most developed in humans. And there are areas in the mid area of the prefrontal cortex that have strong connections with the limbic system. And it's an interaction between the two that seems to be associated with emotion. Several aspects of the brain are relevant to understanding mood. So neurotransmitters are how the brain cells or neurons signal to each other. So each brain cell releases neurotransmitters in the synaptic cleft, and that triggers the next neuron to signal. So that's how messages get passed. And of course, you may have heard about serotonin deficiency. So serotonin is a neurotransmitter. The brain is also influenced by hormone systems, for example, the stress hormone system or cortisol system, thyroid systems, and in turn, so the brain controls or influences the hormone systems. The hormone systems influence the brain. And then finally, within brain cells, within individual brain cells, there are second messenger systems. And these systems are involved in taking that message and converting it into an action within the brain cell itself. And so you see an example here of a neurotransmitter that in turn activates a G protein that leads to a second messenger cascade. This is a little bit advanced, but evidence from genetic studies suggests that bipolar may have more than one cause. Important contributions then come from dysregulation of neurotransmitter function, for example, dopamine, norepinephrine, glutamate, and gamma-aminobutyric acid, or GABA, dysregulation of hormone systems, especially the stress hormones and thyroid hormones, and then dysregulation of signaling within neurons, inositol monophosphatase, protein kinase C, and glycogen synthase kinase 3 beta, as well as mitochondrial dysregulation. So these are all aspects of within the neuron regulation of those second messenger systems. But neuroimaging studies consistently indicate that there's dysfunction in anterior paralimbic and overlying prefrontal regions. So that's those two areas that we talked about. So what is bipolar and what isn't it? So doctors didn't make it up. It isn't just a phenomenon of Western countries. It isn't only an illness of this century. It's not true that only weak people have it. In fact, there's evidence that people with bipolar may be better functioning in important areas. It isn't a contagious disorder. Psychoanalysis and homeopathy are not useful. You can't cause it yourself, and it isn't incapacitating with treatment. So recent studies point to a complicated relationship between bipolar and success. For many people with bipolar, it's a challenge to reestablish a fulfilling life after being diagnosed with the condition. But for some people, bipolar may be associated with increased success in creative professions or in leadership professions. And there's some evidence that higher childhood IQ may be associated with bipolar. So the story isn't as simple as bipolar is a deficiency or a negative condition. One way to understand this is to see bipolar as a condition associated with genes that may confer some benefits, at least in small doses. In the next section of this talk, we'll discuss symptoms, including energized symptoms, depressed symptoms, and mixed symptoms, symptoms with both depression and mania, as well as rapid cycling. We'll talk about the course of symptoms over time. In particular, we'll talk about the importance of DMI or MDI course in predicting response to treatment. We'll discuss the difficulty of staying in treatment because of the long gap that typically occurs between first and second episodes. And of course, we'll have a chance to give you some tips about managing bipolar better.